Subscribe to our YouTube channel and press the bell icon to get the latest updates.
The Print off the cuff, powered by Raheja Corp, corporate partner Airbus, airline partner SpiceJet, in association with NetSurf Network and Jindal Steel and Power, healthcare partner Pharmed Limited.
I'm so happy to be beginning what promises to be a more knowledge enhancing, if I may say so, session of the print off the cuff. Knowledge enhancing because this is a time when, just like in the past or even now, everybody claims to be or believes that he or she is a cricket expert. Everybody now seems to think that they are virologists, epidemiologists, economists, or maybe all rolled into one. So in this time, to get somebody, a real practitioner, and somebody who, when finally an answer is found to this coronavirus, the answer will have to be a vaccine, and who then the whole world will rely on to deliver that in numbers is Adar Poonawalla, owner and CEO of Serum Institute of India based in Pune. One little gem based in Pune, which is not so little because it is the largest manufacturer of vaccines in the world. 1.5 billion a year, that is 150 crore vaccines a year. That is just about 20% of the world's population equivalent. So, Adar, welcome to Off the Cuff, and I look forward to a tutorial now.
Thank you, Shekhar, for that kind introduction. Nice to be with you.
Tell us a little bit about your company and why is it Serum Institute? I know that all private hospitals call themselves research center and institute now for tax breaks, etc. But why are you an institute?
Well, in 1966, when my father founded the company, we were an institute where it was based on learning and making serum-based products like anti-tetanus serum and anti-snake venom serum. But then later we expanded into vaccines and monoclonals and other things. And we never got around to actually changing the name, which perhaps has a more life sciences kind of broader aspect to things and what we're doing today. And perhaps we will change the name, but we always thought it was a lucky name and we thought it would work in those days dealing with the government of India, as a government institute, semi-government institute to get government orders, and ease of doing business in those days was a myth. So we thought that would help.
Government was the sole buyer of all vaccines those days.
Yes.
And you are famous for your horse breeding business because Poonawallas means horses and races and glamour.
Well, the horse racing hobby and lifestyle has always brought that name to the family, and our vaccine business, which is the real one, impacting humanity, has always been very low key. And that's partly, I suppose, because we've always been a private listed company and, never had to make these sort of statements that we're making today and coming out in the media. So that's perhaps why we've been known for that.
But if I understand correctly, it's the horse, it's your fascination for horses, family's fascination for horses that led you into vaccines to begin with. Tell us that story.
Yes, as we were chatting earlier, my father used to give these horses to the Hafkin Institute for them to use that for anti-tetanus serum and anti-snake venom serum. And then he decided that why doesn't he do this himself, and moved up the value chain and got into making a tetanus vaccine, and then, diphtheria and so many other combination vaccines. And then we went from there. So that was the background and correlation. Today, people still think we do something with horses and serums, but we have nothing to do with that.
But do you still do something with horses?
Yes, absolutely. We have one of India's largest and best horse breeding and racing stud farms. So that's still doing very well. But that's more just of a passion and a hobby to enjoy on the weekends.
Nothing works out unless it's a passion and a hobby. And I know vaccines are a passion and a hobby for you now. So let me use a horse racing analogy. Today, there are 108 horses in this race around the world for a vaccine for coronavirus. Is a front pack now established? Are there clear front runners in this out of 108?
Well, Shekhar, it's tough to still say that at this stage because you've got a lot of media reports coming. And I've cautioned a lot of people on getting either excited or demoralized by these interim reports that come in through animal testing or phase 1 results. You know, the true test of the vaccine is only in the phase 3. And that's when we'll know the efficacy, we'll know the yields of production, we'll know a lot of things then. So I think for another 2 or 3 months, I would urge everyone in the audience here as well to just completely ignore what's coming out there because, you know, a lot of this news is being fed through also by Wall Street and the investors who've invested in these companies, and they want to naturally create this hype and euphoria. So we must be very careful and manage people's expectations. And I've said this before, whether it's our vaccine that we're developing with Codagenics and others, the Oxford one, well, now the AstraZeneca one together, and so many others, we don't know what's going to work. We can just be hopeful and pray that, you know, something comes about sooner than later.
So tell us about the vaccine that you are working on with Codagenics.
Okay, so we've got 2 in the United States partnerships, which one with is with Themis, where you were using a spike protein on the measles virus, so it's easy to scale up. Again, it's a live attenuated vaccine.
Spike protein is what gives coronavirus its crown-like
Correct.
the name, yes.
It's the protein which helps your body identify.
That's right.
You know that they need to make antibodies toward coronavirus. So you've got that, and it's a very powerful one because it's live attenuated.
Putting that on a measles virus.
Correct, because this is an established and safe attenuated virus. It's not actually.
So measles virus is then the Trojan horse.
Correct. And that's easy to manufacture. It's one of the products, as I mentioned to you, we make at a very high scale. And we're one of the largest producers in the world for this product.
MMR vaccine, I think every baby gets it very quick.
That's right.
And then rubella.
That's right. And then you've got the Codagenics one, which is again a live attenuated vaccine. And again, my emphasis on this is that if you look at what's worked so far in the world, and that's always a good reference point. Today, RNA vaccines, DNA vaccines, and other types of vaccines haven't really proven their mettle, you know. But there's no reason that they shouldn't.
In fact, a messenger RNA vaccine has as yet in the history of science not gone into stage 3 trials.
That's correct. And, you know, the thinking with the scientists and epidemiologists is that you might need multiple doses of this vaccine to give you the kind of long-term protection that you need.
Yes.
So then we've got the Codagenics one, which has taken a broad spectrum and all the possible combinations that COVID could mutate into. And this is very interesting because, as you've heard, there's a lot of talk about perhaps the virus could mutate. Then do we need another vaccine? Will the existing vaccines cover it? And this is where this product, even though it may come out and be licensed 2 years from now, will protect against all the different variants because it's genetically modified to do so. And that's what's exciting about it. So that's why we partnered with them in the United States. And then we've got these other manufacturing partnerships like you're hearing about with AstraZeneca and Oxford. And you've got 1 or 2 other ones, which I won't announce now, but they're in the works. And we're keeping all the doors open because we have multiple manufacturing plants where we could, you know, slip in these technologies to produce at high scale very quickly.
That's the reason I said at the very beginning that whoever wins this race, whichever horse wins this race, has to come to you then for further breeding. Because one horse can't make the cavalry that the mankind needs or humankind needs right now. You need millions and billions of them.
No, and I'm so happy you said that. But I would not say that only Serum Institute. There are another 2-3 Indian vaccine companies which are
very big one.
Yes, and
Bharat Biotech.
Yes, Bharat, Biological Evans, and so many others, Panesia Biotech. So, you know, this is something which has always been a miss. India is the vaccine manufacturing hub, and that has now come about very clearly to the world. And that's a very important point, and we're very proud of being able to showcase that, you know, 70% of vaccines made in the world are made in India. And nobody knows that. And now that is coming about, and that's a very
incredible. Even I didn't know that. We were all aware now that India was the generics capital of the world, but we never realized that we are the vaccine capital of the world also. So you said live attenuated vaccine. Now I know that everybody repeats it, but it always needs repeating. So what is a live attenuated vaccine?
Well, you can make a live attenuated vaccine in one of two ways. You passage the original virus, which is out there, whatever it may be, measles, COVID-19, anything, SARS-CoV-2 rather, that's the name of the virus. And you passage it either genetically or dilute it. So passaging means diluting it in layman's terms to a point where it's no longer harmful to the body, but it will only trick your immune system into believing.
Neither dead nor alive. I mean, technically it's alive, but it can't be of any harm to you.
Well, that is the safety that one has to establish when you passage it or genetically modify it. And that is proved in safety studies, animal studies, and many other things, because a regulator also has to be very careful that you don't license something that could actually cause you any harm. So that's a tricky process. But if you establish the safety, there are no other types of vaccines which are more powerful than live attenuated vaccines, because, ultimately it's the whole virus.
And what is attenuated? Live, I figured live but not quite so living, and living but not quite so live. And what is attenuated?
So the word attenuated means you are removing the harmful properties and tapering it down so that it's not harmful to you. That's the terminology.
And do you usually add a chemical to it?
No, it's done. Yes, sometimes you add a few things to it and you dilute it. As I said, you passage it, or you can genetically modify it. So that's what Codagenics is doing, is genetically playing around with the variations to do that.
Well, I think that should put the entire debate on genetically modified foods in a different perspective now, because there is so much technophobia right now and so much ludditism. Now, tell me one thing. The routes that different people are taking. One is messenger RNA that Moderna we talked about. One is this live attenuated. So first of all, of the current range of vaccines that we usually take, which ones are live attenuated? Which ones pass this definition?
Well, I'll give you an example. You've got rabies, you've got measles, mumps, rubella. Then you've got the killed vaccines, like, you've got the bacterial vaccines, which are killed, pneumonia, the pentavalent vaccines, all of that. And then you've got these protein-based vaccines like hepatitis B. So you've got a plethora of different technologies and means in which we represent these viruses and bacteria to the immune system.
All these routes have already resulted in vaccines which are being used on a large scale, but not messenger RNA yet.
Not DNA and not messenger RNA.
Yeah, and those are the two things on which we've just seen results on monkeys, and messenger RNA we've seen some first stage results which showed some antibody formation.
That's right.
Moderna share price go up and then settle down a little bit.
Well, actually, it's funny you said that. They've shown antibody responses, but it's not neutralizing antibodies to the tune that you might need with a full challenge test of the virus. So I think we should wait for that to come out, and if that comes about, that'll be great news.
Yeah, absolutely. But that's a new route. So the method that Oxford University is using, that's a different method. Tell us
yes, that's a chimp adenovirus.
Adenovirus is a common cold virus.
That's right. That's right. And as you've read about, what they've been doing is that, this was a safe platform and an effective platform that was used by them for the Ebola vaccine. Right. And that, of course, gave everyone the confidence that, yes, it is safe and a possible vector and a good way to even try it out on this. And that's when they, I think, started in January or whatever to work on it. And that's why they're one of the leading developers of the vaccine. And I think they've almost established the safety trials, which is a good milestone to first cross. And now I think they'll go into a few thousand patients in the UK for an efficacy trial.
But these things, as I'm reading, have different challenges, because when you hold these trials for vaccines, you can't follow the method that you have for pharmaceuticals, which means you can't have a randomized group, you can't have a control group, you can't have placebo. You can have that, but then you can't challenge them with the virus.
Correct. So the regulators and the health community will...
That's the ethical law.
Correct. So that is why you have to be able to do an efficacy trial where you can statistically prove that your placebo group and the vaccine arm group was significantly better. Now, what do I mean by that? And there'll be different metrics, by the way, that people will judge. Now, if you read a little bit about the monkey trial that happened with the Oxford product, they said that there was the disease was there, but it prevented pneumonia.
But before that, there was a monkey trial in Montana that showed different results.
Correct. So today we'll have to take a decision that do we still license vaccines, and I'm sure we will, to where if you can prevent pneumonia and death, that is that not good enough, and we can live with some mild symptoms. Because I don't think any vaccine is going to give you 100% protection. That's impossible. You know, even the best vaccines that today exist will protect you to a certain level where you may take a pneumococcal vaccine, for example, and you'll get a much milder case of the disease as opposed to full-blown pneumonia, which will go into your lungs, you build up fluid, and then you're on the ventilator, and then you're a ticking time bomb, and then, you know, there's nothing you can do.
And similarly, influenza vaccine, which is every year, in fact, its efficacy varies.
Now, that's a very interesting point. You know, we made a nasal flu vaccine, and you know, that doesn't show the antibodies when you test it, but the mucosal immunity that you get from it really protects you against the virus, and that's demonstrated in the trial. So that's when I said, and I was cautioning people from getting demoralized that, you know, in this trial, the Oxford trial, if you're not showing antibodies or this is happening, that does not mean that the vaccine is not effective. Ultimately, you have to be able to prevent pneumonia and the upper and lower respiratory disease so that you can survive. If you do that, and if you can demonstrate that, that's when the regulators will say, yes, this can be licensed to prevent and save your life.
So today, in this race, as a racing man, would you say that Oxford is marginally ahead of the rest or substantially ahead of the rest?
No, I think you know the different stages at which everyone's doing their trials. It's a race, firstly, I feel, against COVID-19. I don't think there's a race between any of us that way, because I don't know if we're going to make any money or even get a return on investment, because every company is going to be giving this at a very affordable price.
Dr. Tedros of WHO has said that all countries have agreed that all new pharmaceuticals and all new vaccines and all therapies will be shared globally.
Well, it's a nice sentiment to have, but as you've seen with some of the rows going on in the US and French companies, for example, and others, where technology has been given by one country, and you've got another company manufacturing it or partnering, there can be some political issues that will arise, and we'll have to navigate through those waters very carefully.
You have the French and Trump, there will be issues.
Well, I don't know. It'll all depend on the political relationships the leaders have. Right now, as I said that earlier, between the UK Prime Minister, our Prime Minister, and the US, we've all got, US President, we've all got very good relations as of what we can tell from the news. So I think that should be quite smooth. There may be a little bit of negotiation there, but I think we're all doing something in the interest of humanity. And this is a very important point. Every leader is going to try and protect their population first, and rightly so. But in order to do that, they also need to consider helping and protecting the other countries, because ultimately, to protect your own population with all the traveling and globalization that we see, you can't just look at your own country and ignore everyone else, because if you do that, then that's only half the battle.
Yeah. So I have now a bunch of questions from A.S. Krishna, who says, no commitment, but what is the realistic time frame for a vaccine in the market, any vaccine in the market?
See, a realistic time frame would be 2 years. The only time I made this statement about the AstraZeneca and Oxford deal was that because they're so far ahead in trials, and we were prepared to produce a little bit at risk and keep that stock, as I mentioned, a few million doses a month to build up till October. Hopefully, if the trials are done in October, and this is a major rider, that if they're safe and efficacious, then we could have at the end of this year a potential vaccine with a few million doses for India and the world. Now, there are a lot of ifs and buts in this, and we're going to see how the trials progress. The Oxford scientists feel that there's an 80% chance of success. I won't comment on what I feel because it's not appropriate and unfair to everybody. But, nothing is proven yet. We're very confident, and we'll just have to wait and see. So optimistically, very optimistically, end of this year. Otherwise, all the other vaccine candidates, to answer the question, is about 2 years away between most of our partnerships and the bulk of the other guys, except for, of course, Moderna and one or two others who are already at the same sort of level as Oxford and AstraZeneca.
So this Oxford vaccine comes from Jenner Institute. Jenner invented the smallpox vaccine, which eradicated smallpox in the world. Smallpox vaccine itself went through many avatars. Even the virus went through many stages in terms of how the vaccine evolved. So tell us a bit about that.
Well, I'm not an expert on that, but what I can explain is that traditionally vaccines have taken a long time to develop and establish in terms of safety and efficacy. But what we have today as an advantage is that we're able to use the technology of our time, which wasn't there at the time when Jenner did this, where we've got these established platforms and vectors to use, which we know are safe and we know we can manufacture and do. So to answer that point, the time it took to make that vaccine then with the technology and means and data which we had at that time naturally was taking longer. Today, how long does it take to develop a new mobile phone or a new app? 10 years ago, it was taking perhaps a couple of years. Now you can do it in 2-3 months. So that's to answer the question. But having said that, this vaccine, whoever makes it, will really have to prove not only safety and efficacy, but long-term protection and efficacy.
Right.
We don't want a situation where, okay, we show some antibodies like we've seen, but how long do they last in the system? Can we challenge that by putting that person and monitoring that person after a year in a risky environment and seeing whether that healthcare worker or whatever, whoever's got the vaccine, is still protected? Does he come positive for the disease? So establishing the long-term efficacy and immunity and immune response is going to be the tricky part, and that nobody is going to be able to tell today. That only time is going to tell us with actual evidence.
So I have Navneet Monot, who I suspect you might know. He runs the SBI Mutual Fund. I know that you don't have a listed company, but I presume somebody manages your money. So Navneet asks, could this be a Y2K moment for India? A moment that could make us a global powerhouse in healthcare sector, just as Y2K catapulted us into information technology.
Absolutely. This is the opportunity that the vaccine sector and the biotech sector has been waiting for. India's capability to make biotech products has always been understated. There are so many good companies in Hyderabad. You've got in Bangalore with Biocon. You've got all the testing companies also. Don't just look at the vaccine companies. I invested in a company called My Labs, one of the only ones approved by ICMR, and they're making 2 lakh kits per day now. I don't know many companies in the world that can do that. So this is the opportunity where we have to roll out a red carpet for ease of doing business and bring in investors and partners, where you can have now biotech companies becoming big ones like you see in the US, like you've seen the IT industry grow in India. So this is the opportunity and we mustn't miss it.
So what you're making with My Labs is the RT-PCR test.
That's right. Which, as you know, is the gold standard in testing because it doesn't have the issues of antibody testing.
So if you're making 2 lakhs, then why is all of India using only 1 lakh a day?
I'm so happy you asked that. I've been urging the central and state governments in whatever opportunities and forums I get that please, with folded hands, allow testing so that whether it's corporates or individuals who want to go back to certain activities can test and then get on with their work, come back to work. That's the way to open up. They are just not allowing testing unless you have symptoms. So a lab today, whether it's a government or a private lab, needs a government approved doctor's certificate and other things before they can get tested, which means I have to go to a doctor who will see me in this crisis, give me and if I have no symptoms, but I think I may have it, or I just want to be sure so that I can be safe toward others, they're not allowing testing. What is their problem in allowing testing? Look, even if we run a little short here and there, how does that matter? We need to take that call now in the states and the center and just allow testing to whomsoever wants to do testing. That is why we're not doing more testing.
Particularly
to answer your question.
Crowded cities like Bombay, even Pune, not as crowded as Bombay, but crowded. Bangalore, Delhi, Hyderabad. These cities are the economic engines or economic horses of India. So should there be a selective policy now of carrying out much more testing in these cities, particularly in hotspot areas of these cities, so you can focus it's like a more targeted therapy?
That's a very good idea, because you see, today the government's fear, and rightly so, was that we'll run out of testing kits if we just allow everyone to get tested. Now, if we take your idea forward, practically speaking, that makes a lot of sense, because anyway, most of the risk in cases are in these 5 or 6 cities.
Right.
And also the business, manufacturing, financial hubs and other things are also there. So yes, this would be the right recommendation. Allow 5 to 6 cities, at least to begin with, to allow testing without doctor's certificates, without any harassment, without any Qaida Kanuns. Just let anyone who wants to get tested do it. Because look, I know corporates today who have rung me up and said, we hear you're making these kits. Can we please test all our employees and get back to work? How are you going to open up the economy? How is the fear going to go away from people who want to go to, let's say, a hospital? Today, your healthcare, basic healthcare and immunization, which causes more deaths and issues, is being denied because mothers are scared to bring in their children for immunizations. People who have diabetic and cancer and other cardio and so many other issues are scared to go in, and you can't get treated. Please allow testing without symptoms so that you can do things that are critical in nature. And look, again, I'm not talking about livelihoods, because there's always this debate been, are they lives or livelihoods? I'm talking about lives only. Today, if you can't allow basic healthcare, if you can't allow immunization to begin with, for all these reasons, you're playing with lives only. It's not about livelihoods.
Because now tests are available, unlike earlier when tests were not available.
That's right.
So you live in Pune. A lot of manufacturing giants live in Pune. There are the Bajajes, there is Baba Kalyani, who now also makes artillery guns. There are many others. Pune, before it became an IT hub, was a manufacturing hub. So all these big manufacturing plants and IT plants that employ a lot of people, testing in their hands at their expense could be a big enabler, isn't it? For normal.
Absolutely.
Store.
You've got all these great companies, Bharat Forge, the Bajaj Group, Kirloskar, so many companies. And with so much employment, today you are only deferring the suffering, if I may say so. If you allow testing, you get back to work. Anyone who's found, showing some symptoms, you quarantine them, you test them again at that time, and you keep them away, and you keep a few people who came into contact with what you call contact tracing or whatever. And you just get on with it. Look, this is going to be the new normal. We have to get on with our lives in this manner. But if you don't allow testing, how can you expect people to come back to work?
Also, a country of India's size, India's population, government can't quarantine everybody. At some point, you have to trust people with isolating themselves or quarantining themselves at home.
Shekhar, I've never seen and heard of quarantining the healthy. Everywhere, if you look back in history or even, what has happened, you quarantine the unhealthy. I've never heard of quarantining the healthy. Now, I don't blame the government for what they've done. I think they've done a great job with the lockdown. I think everyone will agree with that. But we now need to come out of the fear that if we open up, there'll be a lot of cases and the healthcare system will collapse. Now, that is not entirely true, and I'll explain why. You will have cases, and we should not be afraid of cases because, as you know, 70 to 80% are asymptomatic. The balance 20% are perhaps not critical. You get a little flu, fever, you take a little paracetamol, headache tablets, you'll get over it. You've got only then that 1 or 2% that becomes critical, right?
Right.
And goes into, ICU or ventilator stage, and even half of those come back out. We've seen that now. That's very clear. Let me add one more point to it. Then they said, but if even 1% of the entire population goes critical, that's still 10, 15, 20 million people. But again, that's a wrong way of looking at it because perhaps 1% will become critical only in these densely populated places.
Right.
You can't say 1% in the whole country because look at the way we live in these villages. You got more than 100,000 villages. Correct me if I'm wrong. I don't know how many villages, but I'm sure it's more than 100,000 villages and locations. So you're not going to have 1%. If you take that as a statistic to extrapolate the data, that you'll have 15 million people suddenly looking for hospital beds.
So also you can rule out almost everybody up to the age of 40, 45. So that's a lot of people in India. People older than that.
And we're a young this population, and you've got this data about BCG vaccine. You've got our genetics. You've got our climate. You've got all these other factors that people have talked about. So I don't think we should compare ourselves to Europe and United States. We have to look at ASEAN countries. We have to look at ourselves and scientifically and logically take the next action. I think today, both the state and central government have a fear that, look, if they make a decision, then they're going to be hung for it. But I think now it's time to make a decision and nobody is going to hang you. We applaud the work that has happened so far, right? We can learn certainly from the mistakes, which I won't go into because, who are we to criticize sitting on the sidelines? We all know what mistakes we've done and we need to correct them going forward. But having said that, we now need to make decisions. And not making a decision, making these multiple announcements, notifications is not bringing back the demand and sentiment that we need for the spending to come back. Giving loans and liquidity, we've all established that now, is not going to help. We need the sentiment of spending money and demand to come back with timelines to say, look, at this time, this month, in this year, we are going to come back fully. Everyone's going to be allowed to do everything. Go about doing your business, manufacture, sell, buy, go out there and do all this. Take your precautions, do whatever you can. Don't have unnecessary social gatherings. And that's the way we've got to get on with it till we have a vaccine and herd immunity, which again, let me tell you, herd immunity will come after a couple of years. Don't expect herd immunity to come in 6 months. It takes a long time for the community to, for the disease to spread in different communities, different populations and geographies to really build that, what we call true herd immunity that we have against other diseases like flu, measles, and other things. Of course, combined with the vaccine as well.
Yeah, so I have two questions which are linked. I think you've answered these to some extent, but still. There is Dr. Jagdish Chinappa from Manipal Hospitals, Bangalore, and there is Colonel R.K. Dargan from MET University. So Dr. Chinappa's question is, there are at least 8 vaccines under development. Which are likely to be the earliest in the markets and how will the supply be prioritized? You answered it a bit, but you can again recap.
Yes, again, as I said, it's still too early to say which one is going to succeed or fail. You've got Moderna, you've got the Oxford one and AstraZeneca and 1 or 2 others, including 1 or 2 Chinese candidates, which are leading at the moment. Again, as I said, too early to say. The equitable distribution part, as I again mentioned, will be first to our own country and India. That's what I'm going to make. And I have made as a deal breaker with anyone that I've partnered with, that if I cannot provide at least 50% of what I produce to my own country, I'm sorry, I cannot partner with you because that's the least I have to do for my country. And then we can look at other countries.
You even said that in anticipation of vaccines being cleared, you were willing to invest money and produce at the risk of having to junk it.
Yes, I was initially going to produce very large volumes and go into hundreds of millions of doses. But now I think, I mean, I've been advised also to be a little more cautious and not so gung-ho in light of all the trials and different ups and downs that we're seeing, and make a few million doses instead of a few 100 million doses, which I was planning to make. And look, of course, in 2 or 3 months' time, if there's some serious positive indications with data, we can immediately ramp up and scale up to a few 100 million doses. So that's what we're looking to do. And we're going to talk to partners, and if there's going to be some de-risking from governments and others to give some advanced market commitment, then we can still go into hundreds of millions of doses very quickly.
And Colonel Dagan wants to know that once these things come up, how would prices be kept within manageable levels? And how do you then balance profit making with larger common good?
As I said, the COVID-19 story, at least for us, is not going to be hugely profit making. It'll be sustainable. Now, having said that, we've always made our vaccines at a very, very affordable price and cost. That's public information. And it'll all depend on the innovators who will put down their qaida kanuns on royalties and other things that they may want. And that could influence the pricing. But let me just say that I don't think any citizen of India or any other country for that matter is ever going to have to pay from their own pocket for a vaccine, because the governments and insurance companies are going to take this on at whatever price that manufacturers make it at. But having said that, at least I can speak for Serum Institute, it's going to be at a very affordable price like we've done for all our vaccines.
And government will provide it. So there's a linked question from Shalini Pabreja, who's one of our watchers, who said that, are you going to go ahead with the risk of manufacturing the vaccine from Jenner Institute? That you've answered that
we've answered that.
A few millions, not a few hundreds of millions yet, and you will watch. And if results get better as time passes, you could
we can ramp it up
quite quickly. Then we have Devopriyo Bhattacharya. Good question. He says, why don't we see so much vaccine research in India?
I'll tell you, there is a lot of vaccine research going on. We've got our own patents for some of the vaccines that we're about to launch, and there are some companies in Hyderabad who are doing that as well. For example, we've got the first dengue monoclonal antibody, which we're going to launch end of this year, hopefully. We've launched the first in the world rabies monoclonal antibody in partnership with the Massachusetts, which we did that 2 years ago. And look, you're going to see as vaccine companies become bigger and larger, they'll be able to afford the research.
Rabies vaccine, like those dainty French vaccines that you get like a little flea bite. We are an animal-loving family, so.
No. I'm referring to the rabies monoclonal antibody that you have to give along with the vaccine when you get bitten.
I see. After you've been bitten, not as
yes,
a
yes. Also, dengue monoclonal is a new development where we have a cure for dengue. We're establishing the dose and the efficacy. Will be starting that trial in the next 2 or 3 months in India, and probably end of this year we'll have a dengue monoclonal available also in the market, because you're going to have all these waterborne diseases also coming about with the monsoon around the corner. But to come back to the question, why? Indian vaccine companies have been providing, because of Indian price control, and this is something with the Department of Pharmaceutical Pricing Industry, which needs to relook at it, is that in the US, look at the profits these companies make. So they can fund their research. Hundreds of millions of dollars go into developing a new vaccine. You've seen how much Moderna has spent on this. You've seen how much Sanofi, GSK, all these guys, Pfizer have spent.
Or Gilead,
all these guys, because they have that kind of valuation, because they have that kind of pricing. Now, if we can't have that kind of pricing or some reasonable pricing in India and other markets, then how do you expect research to be funded? We get our research funded internally and through grants, from the Gates Foundation and many others, and we somehow manage that way. So that's to answer your question, why we don't have, billions that are. If you gave me $2 or $3 billion, I'm sure I could invent and develop, a plethora of vaccines that, is being done in the West, but we don't have that. So that's to answer your question.
My colleague, Sandhya Ramesh, who's our science editor, obviously she asks more intelligent question than I would. She wants to know that what other vaccine trials are going on in India right now, which are not affected by COVID. Dengue you mentioned just now.
Very good question. Dengue, we hope to start. We've not started anything. In fact, we're going to apply to the regulators very soon to do that.
That be the first dengue vaccine in the world?
Not a dengue vaccine, a dengue monoclonal.
Oh,
So that's an antibody.
For
So
treat-
within 2-3 days of hospitalization, if you take this on a drip, you will hopefully be completely cured. It removes the virus and its effects, and your platelet count will go up. Now we're trying to establish what kind of trial to do. We're going to apply to the regulator soon. But to answer your question,
the therapy.
yes, to answer your question, again, because of not being able to open up, because of our hospitals and clinical sites not being able to function because of lack of testing, and this fear psychosis that we're all going to die if we go out there. Even clinical trials for so many vaccines of all my other friends in the vaccine industry and pharmaceutical industry are suffering because you can't do these trials. You don't have people to do it. You don't have patients coming in, So that's where we are. So it's affecting everything.
So you walk around in an environment filled with live viruses. Do you? Do you feel scared?
I mean, I have a lot of these live viruses around, but I wouldn't go into an area without all the full precautions and a full hazmat suit to do that. But I don't really need to enter the actual areas where the virus is being handled. I have some very dedicated staff who does that for us.
Yeah, but your people do. So you think the facilities and the protections are good enough? You trust those fully?
Oh, absolutely. We're adhering now to the highest standards. One day when you can come down and have a look at the kind of facilities we've built. We've built one of the new largest plants. It's 2 million square feet, which will comply to the European and US standards. Everything is imported, from Germany, Italy, France, the paneling, the flooring, the equipment, the systems. Yeah, so we don't spare any expense on quality.
The entire world is buying your vaccines. You better get it right. Himani Chandna, she covers pharma and health for us. Again, a wonderful reporter. I don't know if she's been in touch with you. She's asked, you mentioned this, she's asking a bit more. She's saying AstraZeneca is now also in discussions with Serum Institute of India for distribution of Oxford University's COVID vaccine. What does that collaboration mean? So what does AstraZeneca do?
That's the only question I cannot answer because I don't fully know the answer to that. It is a relationship between those two companies, between Oxford University and AstraZeneca. Exactly what that relationship will be, perhaps she can reach out to them and get a response. Right now, we are in discussions with AstraZeneca to, decide how many millions of doses we will produce, which countries will we give it to, how we can do that technically also. So that is an ongoing discussion right now, and when that's concluded, I can share that with everyone.
But I should, as a likely candidate for the vaccine, hopefully, should I see it as an effort at profiteering? Because think about big pharma profiteering.
No, absolutely not. The thinking behind the UK government and Oxford partnering with AstraZeneca was that because they're a big pharma, a British pharmaceutical company with good ethics, good quality, and good global reach, they would be better positioned to scale up the manufacturing with multiple partners, distribute it, and various other things, which perhaps Oxford being a university, it's not their work. Their work is a teaching institution, a research organization, a center of excellence. But then, to commercialize, produce a vaccine, et cetera, that's the job of a pharmaceutical company. So perhaps that is the logic why they, would have gone to them.
But I was reading about the Jenner Institute the other day, and I read up on Jenner because the institute has a link to his life story. It tells you of how he gave up a very successful practice in early 19th century to work on this vaccine. And his compensation and reward for all that he had sacrificed was 8,000 pounds.
Well, that's remarkable. There are a lot of people who've sacrificed financial gains for the greater good. And in the interest of science and development. So, that's why he was a legend. And
170 years later after that, the world said smallpox is over. We don't even need the vaccine. So in fact, I am of the generation that had the vaccine. I'm not sure you are the generation that had the vaccine.
I think I was just born a little bit afterwards. But, yeah, I think that was one of the few vaccines that totally eradicated a disease. Today, even polio, if you look at it, the billions of dollars that have gone into giving it, distributing it, and the vaccine production and vaccine cost, measles, you still have cases coming up. We're still not able to eradicate a disease completely. And that's something very important to note, that even when a vaccine for COVID-19 comes about, we're still not going to eradicate it completely at 100%. And that's important to know, because a lot of people think, oh, the vaccine will come and then that's the end of it and we can all live happily ever after. I mean, there'll be a significant improvement, but eradicating a disease is a whole different story.
Well, there'll be vaccine, there'll be some therapies also, hopefully by then.
Absolutely.
So Himani wants your view on all the therapies which are under trial now. That's remdesivir, favipiravir, ivermectin, tocilizumab, etc. How are you looking at these trials, and what is it that looks promising to you?
Well, I think a lot of these drugs have been used for other issues, and that's where some safety has been established. But at the same time, we also know that they're very toxic and have a lot of reactions and other negatives. So if someone is really critical, their physician, their doctor and physician is going to have to decide, in this critical state, do we prescribe something that is under trials? Do we not? Do we wait? And look, today, I still haven't seen proper data to prove without doubt that any of these drugs, and I really hope that one of them works out, has been able to prove safety and efficacy to treat COVID in a double-blinded controlled study, where you can show within 3-4 days the patient's recovering compared to the placebo. So as soon as those trials come about, then the world will know, that this is something safe, and the regulators can then recommend it. Right now, we can make all the hypotheses that we want, but we should not make any recommendations until the trials are fully completed.
Now, the most polarizing drug in the world, hydroxychloroquine.
We were really looking forward to it and hoping that it would work. I think some of the trials haven't quite worked out, but there's still some studies ongoing, and maybe it'll work out. So we'll wait and see what happens. We're all trying to get such a easy fix. Even someone like myself, I also told my chemist to send me some hydrochloroquine to keep it and stock it, hoping that it'll work. And, even as a preventive, to take something a little bit, maybe a half dose or a single dose. But I think till all the trials are over, we really can't come to any conclusion.
Are you taking it? Are you taking it on the basis of ICMR's notification?
No, I'm not taking anything right now. I'd only bought a little bit at that time when the hype was there.
Is the staff taking it? Are you?
No, because all drugs have their own side effects, and we don't want to take anything unnecessarily right now. At least if there's no disease, you don't want to unnecessarily load your system with something as a preventive at this stage.
Nilab from NetSurf, he says, since the virus is evolving and European, North American, and Asian strains have been characterized by a different mutation pattern, does it mean that the vaccine finally will be specific to each strain?
A very good question. Nobody on this planet right now can answer that, because the vaccine candidates that we're working on do have, and that's the silver lining, a broad protective nature to the various mutations. So far, there hasn't been any significant mutation that we think the existing vaccines under development will have a problem, but going forward, that could change. And that's where I mentioned to you, Codogenics has the edge, where it has this broad, very broad-based approach in its ability to make a vaccine. And we'll just have to wait and see. And I really hope that there aren't very severe mutations where we all have to go back to the drawing board and make a whole new vaccine from scratch. That'll really be a disaster.
Our managing editor, YP Rajesh, he wants your view on the anti-vaxxers and anti-vaxxer movement,
Not
including
only,
sections in India who even oppose polio vaccines.
well, I think they're all shutting up right now, most of them. You see, today, even the religious leaders, forget the anti-vaxxers, have admitted that science is supreme and we have to maintain social distancing, do all the other things. And whether it's God, whether it's anti-vaxxers, whether it's Ayurveda, homeopathy, so many other things, right now, everyone has put their faith and believes in science and expects science to give us a vaccine and an answer to this crisis. So I think that answers the question that anti-vaxxers will now really be, I mean, some people will still make a little noise, but now they realize that vaccines really do protect you. And perhaps, and I hope, and I really hope, and I have nothing against the anti-vaxxers because they're only saying what they truly believe and what they're afraid of, that they feel that vaccines cause more harm than good. I hope that for the other vaccines that protect children at least, they will bring their children forward and get vaccinated because now their belief in vaccines will become stronger. And as a result, we'll all be that much stronger as humanity and protect our young and not believe in this nonsense that vaccines cause harm.
And if you believe in God, then God also made the vaccines, isn't it?
Correct. God gave us the ability to develop vaccines through science. So that's what I've always told all these chaps.
Polio, at least we were still able to prevail. And in fact, the only time I end up having polio drops is when I'm going to Pakistan or parts of Africa where polio is still there. And I know why babies don't like it too much because it's so salty. But what about something like human papilloma virus, which is very important for women? Why did this country step back from making that a part of our universal program?
You know, we may have taken a step back, but I have no doubt that the scientists, the epidemiologists, the advisors to the government will certainly put it back into the program because it's the single largest or second largest killer in women.
That's right.
The HPV. And
because it causes uterine cancers.
Yes. And, you know, there was a little controversy, which was, I would say, unfounded because, you know, the deaths that happened in that trial were due to accidents and suicide and other things completely not related to the vaccine. And the vaccine just got a bad name. It became political. And I won't go into it on this show, but we don't make it yet. We're going to make it in 2 years' time or a bit less than that. But the big pharma companies, which have an excellent HPV vaccine, I must say, unnecessarily got flack because of political and other reasons, which were completely unscientific and illogical. And the government will relook at this. And this is, let me tell you, the single biggest protector as far as vaccines go for women. And, you know, the Gates Foundation has said this publicly everywhere. And everyone in the health community agrees with this. There is no scientific mind today that feels that HPV vaccines are wrong or bad or dangerous. And, you know, you've got excellent vaccines that GSK, Merck, and all these other big pharma make. And we're going to make one soon as well at a very affordable price. So this is something the government will relook at it. And I'm sure in a year or two, hopefully they'll put it in the immunization program as well.
Couple more questions because you have other stuff to do. YP Rajesh also wants to know that do you see a downside or a particular risk in going for a vaccine at such a breakneck speed? These are patient things.
Absolutely. And, you know, that's why I've decided to also do a clinical trial in India, which is also required by law, by the regulators, but an extensive trial for safety and efficacy, even though the UK will have done their trial and studies, because again, very rightly so, we don't want to rush something. It's better to wait a few more months, but have something you're really sure about in terms of safety and efficacy. So we're not going to rush it. We're only rushing the manufacturing. We're not going to rush the safety and efficacy studies and all the other precautions we want to take. So let me make that very clear, you know, to everybody here. We're only rushing the manufacturing at risk, but we will not launch it and make it available, and neither will the regulators in India, who are very qualified and smart, to not allow us to do this unless it is fully established in safety and efficacy.
So I'll take two questions together because they are linked. Sankalp wants to know what is the R&D cost of a vaccine like this or any new antivirus vaccine like this. And Piyush Jhawar wants to know that has there been any government support to your industry? And what else does the vaccine industry or vaccine entrepreneurs like you expect from the government?
Well, I'll answer all of those in two parts. A typical vaccine does take a few hundred crores to develop, scale up, including the manufacturing plant. It depends how big you make it, but it could even go into 1,000 crores. The government has been very supportive. It has already agreed to fund a few clinical trials for some of the vaccines, including the BCG vaccines. They have also supported in terms of doing away with a lot of regulation. You asked me to put a percentage, chance percentage, and I said 70% within 2 years. Yes, it's possible. And let me also tell you, there's a 70% chance or higher that whichever vaccine succeeds, one of the Indian vaccine producers, whether it's myself or the companies in Hyderabad and Delhi, will be producing a COVID made in India vaccine. And I think that's a very important point, from a global standpoint as well.
And is there a reason why your company is not listed?
Yes. In fact, in hindsight, it's good that I didn't raise funds earlier on, because if I was listed, I wouldn't be able to take the very decisions that we're talking about of manufacturing at risk, making these big plants without any logic or demand. That is why we are today in the position that we're in today. If I was accountable to investors, the banks, others, perhaps I wouldn't be able to do the things I can do today.
You are liberated from the tyranny of quarter se quarter tak results.
Yes, and perhaps, I wouldn't be able to be so affordable in my pricing.
Right,
The big pharma, the multinationals they're not evil companies. They are just giving returns to the investors that they've promised them.
Right.
And because of that very reason, tomorrow if I do list, I don't know if I'll be able to sustain my pricing. And that's why I said that, look, we'll cross that bridge if we have to. And, that's why we haven't listed.
That's so wonderful of you. So stay like that and you can make enough money for yourself. If not from nothing else, then from horses. So please carry on. You live a wonderful life that's useful to so many other people. Adar,
thank you.
I'm so happy to have had this conversation finally.
It's been my pleasure. Thank you.
The Print Off the Cuff, powered by Raheja Corp, corporate partner Airbus, airline partner SpiceJet, in association with NetSurf Network and Jindal Steel and Power, healthcare partner Pharmed Limited.